All right, getting close.
Great. I think we're now streaming live on Facebook. All right. Good afternoon, everyone, and welcome to Divergent Minds here at SSM Health Treffert Studios. I'm your host, Dr. Ashvin Sood, and today it'll be a special episode of Divergent Minds because I'm by myself. As you notice, Dr. Jeremy Chapman is not here today, nor do we have a special guest. So I thought I would bring all of you to getting a better understanding of how psychiatrists, child psychiatrists give lectures, talk to other doctors and clinicians about certain topics. Because, hey, we're all learning. And I thought today would be a great opportunity to talk about one of my favorite topics, which is sleep. Sleep is something that we all do. And I want to talk about a little bit of education about it. So before I begin, just remember, follow us on SSM Health Treffert Studios or any of our social media pages. Please, 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 if you have questions, this is your opportunity to ask them, particularly about sleep. And it is a very popular topic. So join me today and let's get started. All right, so we're going to talk primarily today about children and sleep and how do we give parents those extra needed Z's. In our agenda, we're going to talk about our understanding of sleep. And then we'll talk about how do children typically sleep through the night. And then we'll talk about sleep disorders and how to kind of get a better understanding of how to take a sleep history. Now, I'm probably not going to get to behavioral treatments and medication treatments because one, that's for clinicians typically to kind of learn what to prescribe and what to give to their patients. But two, you're probably going to run out of time. So today's more going to be talking about the origins of sleep and what's important about it. So let's do a little science, right? Let's take a step back and ask ourselves, why do we sleep? Well, our physiology has been altered to respond to the rotation of the planet around the sun. Our sun and our planet moves like this. And the sun, or the earth, as it angles itself towards the sun, in a different rotation, we get closer to the sun. And in response to this rotation, our bodies have developed a way or a biological drive known as the circadian rhythm that enabled humans and other sentient beings to anticipate change in the environment rather than react to it. So this is controlled by a small portion of the brain called a suprachiasmatic nucleus. And at this portion of the brain, the circadian rhythm is basically kind of originates and is defined by two big processes that work hand in hand together. One of them is known as our homeostatic sleep drive or sleep pressure, or what pushes us to fall asleep. And the other rhythm is the circadian wake drive, what keeps us awake. So if we look at this chart, the homeostatic sleep drive, or what pushes us to fall asleep, is the purple arrows. And they are showing the body's need for sleep is driven over time at later times to increase. So that drive for sleep increases over time. How does that drive for sleep increase? Well, our body releases substances that help us fall asleep. One of those substances is known as adenosine. Adenosine, if you're like me and a coffee addict, adenosine puts us to sleep. So coffee or caffeine blocks adenosine from working, and which causes us to stay awake. So another substance is called GABA. GABA helps us fall asleep as well. And both of these molecules inhibit us from being awake. We also have other molecules, one you might see a lot, known as melatonin. Melatonin is released a couple hours before bedtime, and that causes us to start feeling sleepy. Agents that block us from being sleepy, meaning they keep us awake, include caffeine, which blocks adenosine receptors, or chocolate or soda. We also think of other molecules that kind of keep us awake, such as histamine. So is anybody on this, what's it called? podcast or show ever taken Benadryl and felt really sleepy? Well, that's because it has what we call an antihistamine agent, meaning it blocks histamine receptors, which keep us awake. So the idea here is that we have a balancing act between different molecules in our body. And this balancing act occurs in this middle red line, which keeps us awake. It's called our alertness level. And as you can see, when we begin to become more alert in later portions of the morning. And then we have this random dip, and then we become more alert in the peakness of the evening. A lot of times people ask me, doctors included, why do we have this dip at around 3 p.m.? Why does everyone feel that afternoon crash? There's actually an evolutionary explanation. Back millions of years ago, our ancestors would, in the middle of the day, the temperatures of the earth would be the hottest, and it would not actually be sufficient to stay alive if you were out in the world. So our bodies slowly decided to say, hey, if you feel sleepy, you'll start to look for shade, a safe place to be away from predators and the sun. And over time, the animals and the beings that survived ended up doing really well by sleeping in the middle of the day. So that's why majority of us, or most of us, have a crash, because we're evolutionarily driven to fall asleep at that time, because back then it kept us alive. So overall, if you're joining us now, I'm Dr. Sood, talking about kind of sleep and why we sleep. But the general summary of the slide is that our sleep is driven by a homeostatic sleep drive or sleep pressure, which accumulates with different substances in our body, such as melatonin or adenosine. And our wake drive helps us stay awake. And that is driven by certain substances such as histamine or such as glutamate and acetylcholine. And so we're all in this kind of balance all throughout our lives with managing sleep. So when you go to a doctor and you ask, doctor, I'm having bad sleep. And they ask you, okay, let's get you what we call a sleep study done. They look at where you fall asleep. They are basically looking at a breakdown of your sleep. And we all have similar breakdowns of sleep. And when I mean breakdowns, I mean that each sleep has each phase of sleep, meaning when we fall asleep slowly to when we fall into really, really deep sleep to when we dream, all have different variations or aspects in our body, and they change. And so our muscle tone changes, brainwave activity changes, and our eye movements change. And all of that occurs throughout different stages of sleep. A full sleep cycle is where we go through these stages of sleep, meaning we go through 3 stages of what we call non-rapid eye movement sleep, and then we finish with rapid eye movement sleep. And the full cycle is typically 90 minutes in adults. This is very different in children, but we'll get to that shortly. When we are awake, we know that our brainwave activity is pretty much high frequency, low amplitudes, meaning when we put brain electrodes on people who are awake, they basically see how the brainwave activity is going. And it's pretty like kind of the waves are like this. You're awake, you're alert. And we call these low amplitude beta waves. And it basically tells us that our brain is ready for action. So then you start to feel sleepy. You start to fall sleepy, we go into what we call non-REM stage 1 sleep. Stage 1 sleep is the lightest sleep. It's kind of like you're in that lucid dream state. We're not dreaming, but you're kind of falling in and out of sleep. You're drowsy, you kind of shake yourself awake. And we spend about 5% of our total sleep time at this point, in our total sleep at this stage. During this time, our sleep roughly lasts for we're roughly in here for about 1 to 5 minutes. And it's basically getting us ready for stage 2 sleep or M2 sleep. where we spend most of our time sleep. This stage 2 of sleep is super important because it correlates with several drops. For example, at this stage, our heart rate drops, our blood pressure drops, the temperatures in our body drop. So if you're often told, hey, you should lower the temperature in your room, it's actually because it's starting to try to mimic where you feel an N2 stage of sleep. So it almost tricks the body into thinking, hey, you're pretty sleepy, because this is what happens to your body when you sleep. And during this time, we find that our brain, our memory, where we consolidate memory, procedural memory, declarative memory, so like remembering certain words, or remembering how to do certain procedures. This happens at stage 2 of sleep, or N2 sleep. N2 sleep is roughly 25 minutes long in the first cycle, but as the night progresses, N2 sleep gets longer and longer and longer. So this is the stage of sleep we spend most of our lives in. The deepest sleep, or deep sleep, is known as stage 3 sleep, and it's known as slow wave sleep due to the fact that the body's purpose is, our brainwave activity, the wave activity is very long and very low in frequency. And at this time, our body's repairing tissue, building our immune system, helping with muscle repair. And often, it's the toughest stage to be woken up from. They'll often say, I was in deep sleep. It took me forever. I sleep like a log. Well, often, you're in deep sleep at this time. And stage 3, as the night progresses, reduces in the sleep cycle. Hi, Cassidy. Thank you so much for checking in and hearing about sleep. I'm stoked that you're leaving comments because I'd love to answer the comments. So if you have any questions about sleep or experiences, please let me know. During this stage, also in stage 3 sleep, we often find that kids or children suffer from sleepwalking, night terrors, and bedwetting. So there's actually a phase of sleep in which this occurs. Now, REM sleep, or rapid eye movement sleep, is the stage that comes after N3 stage of sleep. And REM is associated with almost those beta waves, or like the waves that you are when you're awake. However, your muscle tone is what we call atonic, meaning you can't move your muscles. And there's a purpose for that, because in REM sleep is when we dream. It's when we have nightmares. And so your muscle tone has to be atonic because you can't act out your dreams, right? Now, REM sleep gets progressively longer throughout the night. And it's also really important that REM sleep also helps with memory as well. Again, if you're just joining us, my name is Dr. Ashvin Sood. I'm a child and adolescent psychiatrist here at SSML Treffert Studios. And today we're talking about sleep. So my first slide kind of basically went over why we sleep, which means that we're driven by a homeostatic need to basically sleep more or sleep less, and our body's constantly in balance of balancing that out. And our second slide, our sleep cycle, breaks down the phases of sleep, where we typically spend our time in sleep at stages N1 through N3 and then REM sleep. And throughout the night, our N2 sleep, or our kind of middle of the road sleep, lengthens, whereas our N3 sleep, or our deep sleep, decreases. So this is all human behavior phenomenon. It's very well studied, and it changes. And I think it's super important to understand that as a child and adolescent psychiatrist, sleep is different in children than it is in adults. People will say, I want to sleep like a baby. Well, the point of that is because babies sleep a lot, right? And so our sleep changes. As a newborn, you spend more time asleep than awake. But the older you get, the less you sleep. And it's not just the amount of sleep that changes during development, but importantly, the balance between different sleep stages also changes. So generally, as you grow older, you get less and less slow wave, or that deep sleep, while that proportion of light, non-REM sleep, or N2 or N1 sleep increases. Also, many people come to me and ask, I just want to sleep through the night. However, you have to understand, it is totally natural and normal to wake up 2 to 3 times at night. That is a thing. And that is something that we all do. And so we have to remember that our expectation should be to get restful sleep and not feel exhausted in the morning or exhausted in the afternoon. And that if we're waking up 1 to 2 times a night, that's typically normal. I just want to pause. If anyone has any questions or comments about sleep or anything in general, please, please, please. We always encourage it. We want people to ask questions. It's very hard to find time to talk to their doctor about sleep because sessions can be very short. You might not have enough time. So this is an opportunity to kind of just give us some general questions maybe we can use. Cassie asks if you can touch on sleep apnea. Of course, that's a great question. Sleep apnea, also known as obstructive sleep apnea, is the cessation of breathing during sleep. It basically means that something prevents you from breathing during sleep. And during that time, when you cannot breathe, you often will wake up. Will you remember waking up? No. But some of individuals who have what we call severe sleep apnea will wake up 200 to 300 times a night. They will often wake up complaining that they don't feel rested. They will often complain that they will have headaches because they haven't been getting enough oxygen into their system. They will complain that they have bite marks on their teeth because the tongue has lapsed over the airway, which could be a cause of sleep apnea. And additionally, their partners will complain and say, I cannot sleep in the same room because they snore so loud. Sleep apnea, or the blocking of airway going through the lungs while sleeping, can be really dangerous, right? It can lead to increased risk of heart attacks. It can change mood. It can change anxiety. It can lead to ADHD-like symptoms when somebody doesn't have ADHD. So sleep apnea is very prevalent and is often common. We don't see it as much in kids as compared to adults, but with kids, we can see it when the adenoids are overdeveloped or they're swollen, which blocks airway. So when we assess for sleep apnea, often the tongue, or like this tongue blocks, you go to sleep and it blocks the airway. So air can't go in. And the sound of you trying to breathe is, but blocked by that tongue, is snoring. And so what you want to do is, often I tell people if they suffer from those types of things, is to go see a sleep specialist to get a sleep study done. During a sleep study, technicians will monitor your snoring, your brainwave activity, how many times you wake up, and then they can diagnose that you've had this many what we call hypoxic events, or events in which you haven't had oxygen coming into your lungs, and you had to wake up. And if you're waking up 200 to 300 times a night, you're not going to feel rested. And so often they will provide or prescribe what we call a CPAP, or continuous positive airway pressure machine, which shoots oxygen into your lungs and helps you breathe. Ways to reduce sleep apnea: good diet, good sleep hygiene, loss of weight, which decreases the neck circumference, which decreases the likelihood of having the tongue lapse over the airway. The CPAP or machine can be very annoying for many at first, but often leads to really good results. So hopefully that answered some of the sleep apnea questions. All right. Thank you, Cassidy, for such a wonderful question. When we look at the sleep hypnogram, right, and when we look at kind of like the stages 1 through 3, a hypnogram comparing children and young adults, you can see that deep sleep in children occurs often more, but in less in young adults, but proportion of lighter sleep occurs in young adults. So it's just highlighting again and again regarding how sleep changes. I think Cassie might have asked this. I tend to have trouble going to sleep right after playing a sport, or even if my mind is racing. Is there anything to do before that to be able to help me focus on falling asleep? Great question. So sleep is a restorative and relaxing process, but it can be really hard if you have anxious or racing thoughts. So bedtime routine is super important because it helps us relax. I often tell people don't do exercise right before going to sleep. Your heart rate's going to be pounding. You might feel more kind of happy in terms of your mood. But I often say save exercise for about 5 or 6 p.m. if your bedtime is 9 or 10 p.m. at the latest. Additionally, make sure that your routine is very, very, very mellow. So try to, if you can, it's very hard in America and across the world, but try to decrease access to your cell phone, laptop, iPad, anything like that, an hour before falling asleep. Read a book, try a headspace mindfulness meditation, try drawing or coloring or something of that sort, something that doesn't require too much mental task, as well as doesn't require you to what's it called? Be exposed to light, because that will, remember, light is a part of how we react to the world. So if we create an artificial um, uh, uh, thing that looks like the sun, feels like the sun, right? When we see it, it's going to tell our body to wake up, right? That's in the first slide we're talking about how we generate our circadian rhythm. And so that is the portion, right? So getting screens out of the bedroom is super, super important. That is typically what I would always suggest to help putting your mind at ease beforehand. I would also say, and we might not be able to get to this today, but get a sleep diary done. In the slides that I have here, and I'll get to this, taking a sleep history is helpful. So if you're interested in, am I not sleeping well through the night, or I don't really have a better idea, go on to Google and type in the UCLA sleep log or the American Academy of Sleep Medicine sleep log. You can print out this PDF, and here you can actually get an idea of what your sleep patterns are like. For example, if your day of the week is Monday and you are, what type of the day? Is it a work day, a school day? Then from noon to 11 a.m., so in that 23-hour period, you kind of characterize when you exercise, when you drink alcohol, when you drink coffee, when you take your medication, right? With those corresponding letters. And then you shade in when you fall asleep, and then you put a line in when you try to lay in bed. So for example, in this example, this individual had a glass of alcohol at 6, then went to bed for an hour at 7, and at 10 laid down in bed, but then didn't get to bed until midnight, and then woke up once at 4, and then went to bed at 5, 6, and then woke up, it seems, at 7. So this is a good way to kind of get an understanding of what my sleep is like and how we can adjust it. Hopefully that helped answer some of the questions there. So there are plenty of sleep issues in kids. We see this all the time. This is super, super common. They either are exhausted during the day, they don't like their bedtime routine, they're on their phones, much like us. They are co-sleeping, which in some cultures is absolutely accepted and okay. Or they just really, 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 really can't fall asleep. And so it can be an issue depending on where the family is and how the family is doing it. How common are sleep issues? Well, roughly about 25% of children will suffer from a sleep problem. However, 3.7% of kids are actually diagnosed, and 50% of preschool children, 30% of school-age children, and 40% of adolescents have sleep difficulties. It's a very common phenomenon, and it's not something that's just rare. And 2/3 of teens are complain of frequent nighttime awakenings, lots of daytime sleepiness, unrefreshing sleep, and trouble initiating sleep. I'm not going to talk so much about sleep disorders, but I'm going to end on this slide today because I think it's super important. When I talk to anybody about their sleep, I often want to ask these types of questions because it's so easy to get lost and I can't sleep well. So it's really important that you quantify sleep as much as you can and try to get an understanding of the environment. So for example, if a parent comes in and tells me their child isn't sleeping, I ask them, when is bedtime? When do you wake up? How many hours does the child sleep? Do they sleep a ton, or do they sleep kind of broken up? Any nocturnal awakenings, like waking up often or for a longer time? How many naps are they taking during the day? And if so, what time are the naps and how long do they last for? And I think those are all important questions because that gives you the amount of sleep that a child is sleeping. Each child is different. Younger ages, like newborns, will sleep a lot more. 1 to 2 year olds will get 11 to 14 hours of sleep, and it'll slowly decrease over time. But adolescents typically require 9 to 11 hours of sleep. So anybody who says they get 6 or 7 or 8 hours of sleep, often if they're teenagers or younger, are probably suffering from sleep deprivation. Sleep is incredibly important. What you'll often find in teenagers is that they'll be sleep deprived during the week and then binge sleep throughout the weekend because they're in sleep debt. So it's super important to understand how much is somebody sleeping in a 24-hour period. And ask about the sleep environment. With whom, the people or the kids, does the child sleep with? Is it with a sibling? Is it with the parent? Is it in a bunk bed? Is it in a room with bunk beds, right? Are there multiple siblings in the room? Any rituals or practices used to help them fall asleep? Give them a bedtime story. What happens, what's the bedtime routine like? Is it pajamas? Do we do bath time? All those types of things. In what order does that go? Is the room dark and quiet? Is it loud or boisterous? Is there a TV in the room? Is there an older teenager who's on their phone in the room? And what body position do they sleep in? Often you can find kids who are snoring will sleep in different positions than kids who don't snore. And then daytime, is the child refreshed after sleep? Were they dragging? Were they exhausted? And is there any excessive, are they really fatigued or sleepy during the day? And you can often ask teachers this. I am going to stop on that slide just to kind of highlight again. These are the things I'm always asking about. I'm not going to go into disorders today or treatments today because I just want to highlight that sleep is super important. And in summary, we all sleep, right? We all have different stages of sleep, but it's all pretty much uniform throughout lifestyle. It's really important to get good quantities of sleep. It's really important to understand that sleep is restorative. It's great for memory. It's great for muscle repair and the immune system. It's not something that we should skirt by on. It's incredibly important. It's something that's been shaped over millions of years as well. So to think that you can change it or go against the grain, it's really, really difficult because our body is tuned to the sun. This is what we do and how we respond. I want to thank all of you for today's session. I know it's a little bit different than Divergent Minds, but if you guys like it, if you guys like the style, please give us feedback. I appreciate that, Cassie, for asking that question about sleep apnea, because many people don't get the opportunity to hear and learn about that. Dr. Chapman and myself, we're child and adolescent psychiatrists here at SSML Treffert Studios, like bringing psychoeducation and mental health tips and tricks to everyone in the Fond du Lac area and outside of Wisconsin as well, just because, there is not a lot of help out there. But I do want to highlight that just because I'm a doctor, I'm not your doctor. So anything you learn today, use it as general education and knowledge and bring it up with your doctor if you're curious about your own sleep. With that in mind, my 15-minute task for you is to kind of fill out that sleep log at UCLA sleep log. If you Google that, then try to fill out your own sleep schedule and see what it looks like, just to make yourself more aware. Thank you so much for being here today, and I hope you all have a wonderful rest of the week.